Good evening, everyone. Hello, how are you all doing?
Good evening, Miss Nisma. How are you?
How are you? How are you, Dr. Yasser? How are you? How are you guys? Wish you are all doing well. Ramadan Kareem for
Fine,
everyone.
fine. Thank you for
Okay. I'm going to mute the mics. I'm so sorry for this, but this is just to make the recording much better for you. Welcome to the class, okay? And I hope that this lecture becomes beneficial to you, all right? So what we are going to do today, we're going to correct three letters together, okay? I actually chose the ones in the comments I had on my Facebook group, okay? And we're going to also have three role plays. And I'm going to choose the people for the role play randomly. I'm not going to choose people in particular, okay? So, because we don't know who attended and who did not, okay? That is what we are going to do today. If you have any questions, okay, I just would appreciate it if you just keep it to the end, okay? You can write it down in the chat box, and of course I will get to it as soon as possible. All right, so I'm going to share screen with you now in order to see my letters. I know you can see the picture right there, but I'm going to share another screen so you can see the letters while I'm correcting them. Okay, here we go. Okay, I'm going to start with this letter. Okay, all right. All right. First of all, it's better to leave this line empty. Do not write on the very first line. ما حبكتش يعني مش لازم اكتب على اول سطر في الورق. You can leave a line, all right? And then you can go ahead. Okay, that's fine. Did Dr. Jones? All right, that's really good. Okay, good layout. Okay, some people are asking questions on. Okay, they need. All right. They need access. The access is open. This is an open access class. Let me just check with them. Okay. Okay. All right. All right. Here we go. Okay. All right. I think everyone now is here. Okay. طيب. After that, I'm writing to refer Mrs. Walter, a 40-year-old woman whose features are suggestive of severe depression and probably bipolar disorder. Your urgent assessment and the treatment would be highly appreciated. Okay, so we have lots of mistakes here. First of all, we do not use abbreviations of this kind, so we do not say I'm writing that way. It's I am writing. Okay. To refer Mrs. Walter, okay, a 40-year-old woman. Why do we call her a woman? It's not preferred actually to call her a woman, okay? We can say a lady, okay? We can say her job, if she has a job. It's better than just saying woman. And of course, here we have an extra E, okay? All right. So I would take this off and I would just move it to be, let's say, lady. That is much better. So do not use the word woman, female, male. Also the word patient. You don't have to use this a lot, okay? Whose features are suggestive of severe, missing an E here, severe كلكم بتحطولهاش E. There is an E at the end. Okay, severe depression and probably bipolar disorder. Your urgent assessment and treatment would be highly appreciated. Okay, so today Mrs. Walter complained of feeling of not coping and losing attachment towards living. All right. This letter is one of the most common letters in which people try to avoid using the word having suicidal thoughts or having a death wish or something like that. Well, actually, this is a really true condition. Okay, this woman has suicidal thoughts and she wants to die. So it's okay if you say so. And losing attachment towards living is not actually a good way to express the same meaning. طيب ليه؟ عشان ما يبقاش بنقول كلام وخلاص. إحنا we are writing informative writing. Our mission is to deliver the message, okay? But we do not try to manipulate the language. We do not try to actually use figurative language. أي جمل بقى بلاغية أو الشكل ده it can be used in the essay writing while you are preparing PTE or IELTS. I will welcome such expression. But here you can say that she had suicidal thoughts because that is the most urgent thing that upon which you decided to refer her to a psychiatrist, okay? So today, Mrs. Walter complained of feeling, I believe, unable to cope. عشان ما يبقاش off. Feeling unable to cope, okay? And suicidal thoughts, okay? Although she feels tired, she is experiencing sleeping difficulties. Additionally, this is a new sentence, then followed by a comma, okay? She felt overwhelmed with responsibilities and had no energy to complete household tasks. Her examination revealed significant loss of weight in the last 2 months due to loss of appetite. Okay, so that's good, but the last sentence, her examination revealed significant loss of weight in the last 2 months. Okay.
نفس التنبيه نبهوني عليه بالاجتماع الأخير.
I'm sorry if somebody is still turning on their mic. Just close it, please. Okay. Mute your mic. So in the last 2 months, هي مش غلط، مش incorrect، بس خلينا نتكلم ان المفروض ان انت بتتكلم معاه بمفهوم ان انا بحط لك الحاجه الurgent قدام عشان ده urgent letter، فانا لازم احطه لك at the very beginning وانا بتكلم يعني بمنطلق ان دي she's my patient and she's been here a lot. Okay, so I would like to show that to you. So her examination revealed significant loss of weight, okay, during or compared to her recorded one on previous visits. Okay, maybe 2 months ago. Okay, that is more specific. That is more specific. And due to loss of appetite, of course, this is okay. On كذا, Mrs. Walter attended the clinic for a routine checkup. She was happy and energetic. Her examination was satisfactory, apart from being overweight, which she managed to reduce it in the subsequent 6 months. طب ما خلاص ما ممكن اقول which، ما هي which دي هي it، يبقى which she managed to reduce in the subsequent 6 months along with increased social activities participation. Okay. Mrs. Walter is married and her 2 children, and has, sorry, two children. She has a medical history of asthma. طيب كل diseases are usually in lowercase condition unless they are named after a person, like Crohn's disease, Graves' disease, something like that, which is well controlled. Please note that her family history is notable for depression. Okay. It would be grateful if you could discuss child care, household maintenance, and this is another thing. Okay, child care is something, household maintenance is something else. Okay. With her husband. Should there be any queries, please do not hesitate to contact me. Regarding the content, I think you were very specific. The introduction was also really specific. Okay. I also believe that you were able to organize your letter in a good way. I can feel the urgency. You have actually communicated the urgency very well by delivering and putting the main point and the urgent point at the very beginning, right? Yes, it's a bit short. I feel it's short, but I think that is due to how you try to expand your sentences. Working on paraphrasing would be a very good exercise for you. That letter would not catch a B easily. You need to work a little bit on expanding your sentences. I mean, in other words, I can say something like, for example, when Mrs. Walter here, I need something to يعني to tell me ان احنا بنتحرك بقى لحته ثانيه. صحيح انت اعتمدت على التايم ماركر ان انت حطيت تايم في الاول او حضرتك حطيتي تايم في الاول، بس كنت حاسه ان كان ممكن ابدا بدايه ثانيه. like مثلا when Mrs. Walter attended on كذا the clinic for a routine checkup, she was happy and energetic at that time. Okay, at that time she was happy and energetic. Okay. Her full examination was satisfactory or was normal, apart from being overweight, for which she was advised to reduce, and she was successful, or she lost. ممكن اقول قد ايه بالظبط عشان بس ان افرق ان انت قلت لي فوق significant weight loss and then you said overweight. وبعدين she lost weight and that was she was happy about that. طب المعيار ايه؟ فكان ممكن اقول ان هي كانت overweight وكان وزنها قد كده وبدات ان هي تنزل وزنها وصلت لكده، لكن today she's at that weight. Okay, I would give it a C+. It's between C+ and B. It's a well done. Thank you. Okay. Okay. So طيب dear Miss Graham، طب الدنيا فوق مش مظبوطة، يعني مش مكتوب الداتا ومش مكتوب العنوان كويس، مش مكتوب الدنيا كويس. أنا مش عارفة ده بسبب إن اللي كاتب بيحاول يضيق المساحات عشان تكفي في المكان ولا عشان إيه؟ تمام؟ طيب anyhow لازم الداتا بتاعتنا كلها يا جماعة تبقى فوق كاملة. اوكي، يعني بنكتب اسم الدكتور برضو again، تسيب سطر الاولاني وتكتب المكان بتاعه وتكتب الداتا اللي موجودة عندك. طبعا هنا I think this is Mr. Barry Jones. Okay, we are sending the letter or the referral letter is to an occupational therapist, okay, which is not who is not a doctor. Okay, فممكن ان احنا هنا بنكتب اسمه وان هو occupational therapist، بعدها بنكتب الفاسيلتي اللي هو فيها، الشارع، المدينه، البوستال كود، وبين كل حاجه والتانيه ما بنحطش اي كومات، بنسيب سطر وننزل نكتب التاريخ، او العكس نكتب التاريخ اول حاجه ونسيب سطر وبعد كده ننزل نكتب الحاجه تحت. الافضل طبعا ان احنا نكتب التاريخ فوق لان ده الشكل الجديد، لكن لو في ناس لسه بتكتب بالشكل القديم ومرتاحه فيه، اللي هي بتكتب التاريخ بعد ما بتخلص كده زي الشكل ده، it's okay, no problem. Right? طيب. Dear Miss Graham, right, Miss Graham, Mr. Barry Jones, okay. I'm writing with regard to Mr. Jones, a 44-year-old forklift driver who wants to return to work after a back injury. Your expert assessment of his workplace would be highly appreciated. Okay, I'm writing with regard to Mr. Jones. I believe this is a good start because actually this is not a doctor, so you shouldn't say I'm writing to refer. So you can say I'm writing with regards. I'm writing to request a workplace assessment. كل ما خليت الpurpose قدام كل ما بيبقى أفضل. Right, so here it's a good thing. We have here just okay a back injury. The word injury is accountable, so it needs actually an article. Your expert assessment of his workplace would be highly appreciated. That is good. On كذا Mr. Jones, this is a man, Mr. Jones. خلي بالكوا, this is a big and fatal mistake to actually mispronounce the name of the patient or the doctor or misuse the title according to the sect of the patient. Mr. Jones attended the clinic complaining of a 4-day history of progressive pain after lifting a heavy box. An X-ray was performed and excluded disc prolapse. Okay. At that time, lower back strain was suspected. Consequently, the patient, كلمة patient, which again, nowadays I don't recommend that we see it a lot. The patient was advised on daily exercise and medications were prescribed. Right, so medications were prescribed. This is a full independent sentence, so and should take a comma here. In the form of muscle relaxant and non-steroidal anti-inflammatory drug, a referral to a physiotherapist, أي job, أي تخصص بكتب معاه, or an article was conducted. A sick leave was issued associated with a review after 30 days. طيب, a sick leave was issued associated with a review after 30 days. I believe along with is much better, مش associated with, because associated with is kind of something working together, something is taking the same steps as the other, so along with. Of the last few visits, Mr. Jones' condition has deteriorated. However, he was compliant to physiotherapy and treatment. Pain exaggerated and stiffness appeared. Very famous common mistake. Here we go. Okay. Okay. So, what happened here? First of all, خلينا نبدأ من أول ما over the last few visits. Okay. Actually, they are just 2 visits. Okay, so they are not few visits. They are 2 visits. So the last or the following 2 visits would be great. Okay. معلش فاتح المايك بعد إذنكم اقفلوا. Last subsequent. يا جماعة المايك بعد إذنكم لو سمحتوا. Subsequent visits. Okay. Right. Mr. Jones' condition has deteriorated. خلي بالك انت كده تحركت من حاجة very general has deteriorated, يبقى اللي جاي كله دمار. خلي بالك. هو مش fully recovered. بس still هو partially recovered. يعني وضعه النهارده في آخر visit is much better than 3 months ago. Okay, before the 90 days. Okay, طيب. However, he was compliant with not to physiotherapy and the treatment. The pain exaggerated and the stiffness appeared. Okay, طيب. أول حاجة ما ينفعش إن however تيجي في أول الجملة ويجي وراها جملتين. دي مش شغلتها. اللي بتشتغل الشغلانة دي although أو though أو even though. يبقى however مش من الحاجات اللي ينفع تيجي في أول جملة ويجي وراها جملتين. لما بتيجي في أول جملة however بتناقض جملة واحدة بعديها مع جملة منتهية قبلها. فالشكل ده مش هينفع. هشيل however هنا وهكتب although. Although he was compliant with physiotherapy and the treatment, the pain exaggerated and the stiffness appeared. Thus مش محبوبة خالص. عندي حاجة اسمها therefore is much better. Therefore naproxen dose. طبعا كلمة dose دي تستاهل the article عشان noun يعد. The naproxen dose was increased. Extension of medical certificate associated with conduction of other reviews. I guess this is the word, conduction of other reviews. Okay. طيب. ماشي. طيب أول حاجة يعني خلي بالكم remember who are you writing to. يعني دي مهمة جدا. يعني أنا بكتب لمين؟ Although he was compliant with physiotherapy and treatment, the pain exaggerated and stiffness appeared. تمام. Therefore ممكن أقول his time of work and painkillers. خلي بالكم أنا مش بكتب لدكتور فهو ممكن أصلا إيه نابروكسين وإيه مش عارف إيه لأن ده painkillers وماسل relaxants مش أو his medications وخلاص وأكبر دماغي. خلي بالكم pay attention to whom is writing the letter. is reading the letter sorry. فهو اصلا مش دكتور ده occupational therapist. اوكي فمش هتفرق معاه الجرعه زادت ولا قلت. pay attention. الراجل ده مبعوت له الجواب ليه؟ عشان حاجه واحده بس علشان يقيم الوضع الجوب والوضع بتاع الراجل ده هل هو ينفع ولا ما ينفعش. اوكي طيب extension of medical certificate associated with conduction of other reviews مش حلوة مش عجباني. يعني conduction و associated with الاتنين خبطتين في الراس توجع في جملة واحدة يعني. اوكي فممكن اقول extension of medical certificate and planning أو or scheduling another review. مش reviews هي another review لأنه هو جه النهاردة بس. تمام was أو were conducted. Okay. On today's consultation, Mr. Jones' condition has mild improvement. ده بقى اللي أنا كنت بتكلم فيه من شوية. أنت بدأتي بحاجة has deterioration. Okay, so pay attention for such thing. Okay, يعني over the last subsequent أو two subsequent visits و subsequent هنا عايدة على الفيزيت الأولانية. أوكي Mr. Jones على طول بقى was compliant أو Mr. Jones' pain exaggerated and the stiffness appeared although he was compliant with his physiotherapy. وأبعد عن حتة إن أنا أتكلم في حاجة general like has deteriorated. Okay Okay, has mild improvement. He experienced an increased range. طب has mild يبقى he has بقى. He has خلاص كله present بقى an increased range of his movement and walking خليها walks verb and walks up to 30 minutes per day. On future discussion he was bored يعني ايه future further I'm sorry further أنا عشان further discussion he was bored, he is bored, this is a fact, discouraged and wants to, another fact, wants to return to work. A return to work conditioned with no lifting and regular breaks was approved. Okay, الجملة نص ده حلو جدا بس a return to work دي إعادة. Okay. Resuming ممكن. His job conditioned with no lifting and regular breaks was approved. Okay, kindly advise. Okay, this is the verb. Him on duties that he can perform. Okay, not bad. حلو. Okay, مع إن المفروض يعني ده باراجراف واحد. ليه اتقسم؟ ليه أحط الفيزيت الأولانية لوحدها وبعدين 2 visits وبعدين أخلي today. طيب خلينا متفقين على حاجة عشان أنا شفتها كده في الجروبس وفي الفيديوز والناس اللي بتتكلم كتير. أوكي؟ بصوا يا جماعة مفيش حاجة تلزمني في الامتحان إن أنا عندي عدد باراجرافز معينة فأنا هحاول أختلق بأي شكل طريقة إن أنا أوفر بيها عدد الباراجرافز دي. For example, let's say that إن التست جالك إن هو just one visit اللي هي today's visit. أوكي؟ فأنا هعمل إيه؟ ما عنديش إلا فيزيت واحدة. أوكي؟ فبقى عندي introduction و conclusion وكده باراجراف في النص. هنا مثلا ممكن اقول لك ان انت ممكن تقسمه ان انت تخلي الجزء السبجكتيف الخاص بالبيشنت لوحده والجزء الاوبجكتيف والحاجات اللي زي كده لوحدها. طيب بالفعل انا حاولت اعمل كده لقيت الموضوع صغير جدا ومش هيظبط معايا يعني مش هيطلع معايا باراجراف محترم. هيطلع معايا باراجراف سطرين وباراجراف التاني 3 سطور. امشيها برضه يا ميس نسمة؟ لا ما تمشيهاش، خليه باراجراف على بعضه محترم 5 سطور وشكرا على كده. طب ميس تسمى فين الميديكال هيستوري؟ ما فيش، ما لقيتش حاجه ريليفنت. خلاص ما تكتبهاش، مش هنخترع بقى باراجراف مخصوص. فاللي حصل هنا ان هو في باراجراف اوكي والباراجراف اللي هنا ده اختراع، مش اختراع يعني جايبه من بره او جايباه من بره، لا هو قسم خلى دول مع انهم كلهم في الاخر باست فيزيتس، كلهم في الاخر باست فيزيتس. اوكي عشان يطلع لي بمنتج في الاخر فيه العدد ده من الباراجرافز. انا ممكن يطلع معايا ادي باراجراف الانترودكشن، البادي الاولاني، البادي الثاني اللي هو today والكونكلوجن وشكرا على كده والليتر بتاعي سليم وعافى ما فيهوش اي مشكله. اوكي فخلي بالكم من النقطه دي علشان برضو الناس بتبقى فاهمه فكره الباراجرافنج غلط شويه. باراجرافنج يعني الفكره كلها على بعضها خلاص الفيزيتس القديمه خلصت، التوداي خلصت وهكذا. اوكي برضو not bad. اوكي عندنا كام غلطه جرامر بسيطه هنا. اوكي اللخبطه كانت في المنطقه دي، الحته اللي احنا معلمين عليها وعاملين عليها الهايلايتس. طبعا ان شاء الله التصحيحات دي هتنزل في الكومنتس بتاعه المحاضره، تسجيل المحاضره لما ينزل باذن الله. اوكي طيب alright معلش انا مختلف التصحيح سامحوني. Okay, this is the last letter. Right. Psychiatrist. Okay. تمام. Dear Dr. Jones, Catherine Walter. هي النهاردة الليلة على Catherine Walter. Okay, thank you for seeing Mrs. Walter, who is presenting with features suggestive of severe depression with bipolar disorder. I would be grateful if you could urgently assess her condition and manage her suicidal thoughts. Okay, that's a very good thing that you highlighted suicidal thoughts at the very beginning, because this is a very important, alarming, and alerting point we have to highlight for the recipient. Today, Mrs. Walter has complained of having suicidal thoughts, feelings of not coping, generalized tiredness together with poor sleep and appetite. Okay, very well. On examination, her BMI is kaza. She has been attending my clinic since November 2014 for regular checkups. Okay, for her asthma. During her visits, she had reported being tired and overweight. Consequently, a complete blood count and a pap smear were ordered. In addition, she was advised to change her lifestyle. Okay, so you started with today, and then you moved to the past visits as a summary. All right, I will just go on to the next paragraph, and then I will see. Mrs. Walter, who is married with 2 children, is a volunteer at her children's school. She has been asthmatic since childhood, for which she is taking Pulmicort. She is also an مش عارفة ايه for her fungal skin infection. Please note she has a moderate family history of depression related to her father, sister, aunt, and uncle. Okay. Given the previous history, I'm referring Mrs. Walter. I had a feeling that you would be doing this before even reading it. I'm referring Mrs. Walter for further psychiatric assessment. I would also recommend contacting her husband to discuss sending their children to child care and offer help regarding the household maintenance. All right. So, okay, I believe that is not bad. This can be considered as one of the urgent and subject-based paragraphs. Okay, you highlighted the main issue today, the main complaints and subjective part today, and you just had a summary of what was also important in the last few visits. That was good, right? After that, you moved to the background of the patient. That was good as well. Okay, I have a problem here. Given the previous history, I don't want you to use such thing again. I'm referring Mrs. Walter. You already said that. Thank you for seeing Mrs. Walter. It's the same as I'm referring Mrs. Walter. Do not repeat yourself. Repetition. Okay. After that, I would also, I don't want you to use also. I would also recommend contacting her husband to discuss sending their children to a childcare. We do not have such details, okay? All what he said is that you're going to talk to the husband about childcare and house maintenance. So keep it that way. Do not interfere in their business, okay? So I would recommend contacting her husband regarding their child. Or their children care, and we do not use a with help, and household maintenance. Should there be any queries, please do not hesitate to contact me. Okay, not bad. That would be a B for the good way of presenting the letter. All right, so let me move back to here so we can see if there are some. Just going to be someone is asking something private. Okay. Okay, no problem. Okay. Advised to or advised on. Okay. So we have two prepositions with advised as a verb. You advise someone to do something. So to is usually preceding a verb if you're going to use a verb. She was advised to use something, or she was advised on using. On is usually preceding noun. Okay. Date 25/6 is wrong. No, it's okay. Can use such method. It's okay, no problem. Subsequent means comes after that, following. Okay. In this letter, asthma history is irrelevant, so better to not to write. Am I right? Yes, I believe it's irrelevant, and usually when I do this in my classes, I believe it's irrelevant, but that is a very short letter, so highlighting it, maybe the medications could do this. Okay. Asthma could be the causes of depression, maybe because of the medications, and she's having fungal infection as well, so it could be also a reason for this. Some of my candidates did that. يا جماعة الصوت بعد إذنكم. I'm gonna mute everyone. That's it. Okay. Some from my classes, some doctor from my classes did that on a class a few days ago. We were correcting also the same letter, and we had the same discussion about whether this is irrelevant or relevant. I believe that the asthma is not relevant. It's not that important if you're going to mention lots of details about it. But if you're saying that she's asthmatic and she's receiving medications, I think this is very short, so it's okay, can pass. Why use with and the medication were prescribed? Why use with and medications
why use
were
كما يا مس نسمة قلت لحضرتك
comma
الكما مع before and medication were prescribed
because it's a full sentence. Medications were prescribed. It's not a dependent sentence. Okay. Yeah, asthma is so exhausting disease, and it may be the cause. Yeah, maybe, yes. In 3 letters or liter. The third letter. Third. I didn't see date of today in third letter.
I didn't see the date of.
Okay. Yes.
How are you, Miss Nisma? 3 letter ما فيش
I
تاريخ
think it's. I don't know if that was a problem. The third letter, there's a date, but it's after the intro part or after the first part. There is a date.
but مش التاريخ حيكون متاع الاكزام يعني ما يكون في شهر في جون او جولاي. المفروض يكتب تاريخ الامتحان.
لا بص، هو احنا يعني لسه كنا بنقول الكلام ده، احنا بنلتزم بس بالتواريخ بتاعت الكيس not to be confused. لكن on the test date يعني كل امتحان موجود في فيوتشر لاند يا جماعه ده امتحان حقيقي كان وقت التاريخ بتاعه بوقت الامتحان بتاعه، يعني اللي هو بتاع مثلا 23/5/2015 بتاع مثلا مس اندي سوري مس ايزابيل جارسيا، هو كان فعلا امتحان 23/5/2015 مشهور حتى اتقفل يعني والناس قاعدين. اوكي ف يعني that's why the dates are different. في ناس وهي بتكتب بتلتزم بتواريخ الامتحان نفسها او تكتب تاريخ اليوم عادي بقى ما فيش مشكله.
Okay.
I'm going now to look at the people here. Okay, we have lots of people. Wow. Okay, so I'm going to choose randomly 2 people to run the first role play. Okay, so let's are there any people who wouldn't share, or people who would like to share? If you want to share, just raise your hand, say I in the or me in the chat room, so I can see who are ready to share. Okay. Del, who is Del? Del, Del, D-E-L-L, the Del, who is Del? Yes, okay. Yes. Okay. I miss you guys, wallahi. I miss you guys. Okay, who's else? Who wants to share as well? Any others? في ناس رفع عليها برضو. آية، رضوان sorry محمد حمدان. طيب so all right so I'm going to choose آية. okay دكتور آية زيادة. دكتور آية.
Yes,
Okay. Can you unmute your mic? Hello, how are you?
I'm fine, thank you.
Okay, can you hear me well?
Yes.
Okay, so actually this lecture will be different from the last ones. The last ones you were running the cards together. Actually, run the card with me. Okay, so I'm going to share the card here so you can see it. Okay.
Okay.
Okay, can you see the card?
Yes, I can see it.
You'll be the doctor and I'll be the patient.
Okay.
Okay?
Okay. I will read it.
Right, so
Okay.
yeah, I will give you exactly 2 minutes starting from now. You can go ahead.
Okay. Not the word. I like and please, but I have a problem. You have fallen them right. Where when you touch your friend, here and causing the pain that's related to swing. Some people stand to lose the ball. Yeah, just surprised that you're being right.
Sorry, Miss Nisma. I wanted to ask you about there is group in Telegram for role play between us.
Yeah, I will send you the link. Yes, I got your message, but I got it very late. Okay, so that's why I did not send you the link, but I will send you the link.
Oh, okay, because I'm forget it.
Okay. So, Dr. Aya, are you ready?
Yes.
Okay, let's get started.
Okay. I will start. Hello. How are you?
I'm great. Thank you.
Oh, come on. How can I help you today?
Well, actually, doctor, I don't know. I'm still having a problem. Okay, I still have that pain around my right eye. I thought after the shingles were resolved, everything will be better. However, it's not. I still have the same thing, and it's like a burning pain whenever I touch the skin. I also experience spasms every now and then. What's wrong? What's happening?
Yeah.
Oh yeah. Oh, I see. The cause of your symptoms is there is then because you were dealing with herpes zoster. This is the pain happen in your nerve. That often lingers after a shingles rash, and after time, it will go. I don't know.
Well, what do you mean? So do I have to deal with this pain for a long time?
No, it will go after the rash goes away. It will take time, and I will recommend to you painkiller and analgesic as a first line of treatment, as like paracetamol or codeine, and I will give you a Gaviscine cream for topical application, and you
Deep breath and continue. You're doing a good job. Deep breath and continue.
okay, and I think that there will be sensation. It might cause a slight stinging sensation or coughing and sneezing. This will happen when you have your medication, but you will be all right.
Okay, doctor, but the problem is that I've been through pain for a long time, and you know that very well. And I've taken lots of medications, and now so everything is resolved. I'm getting better, but actually this is not happening. Everything is getting worse. So you need to give me something that is not medical. I need any other medical choice. I don't want to take medications again. And to tell me how long would that take until it's completely resolved? I need time.
Okay, I can understand your worry, and first of all, you calm down. This is nothing, and you will go through that. Yes, you will have a lot of medications. Yes, it can work, it can't. It could work, it couldn't, but I will prescribe you anticonvulsant drugs. I think it will help you if necessary. So it will take time. You should be patient.
Okay, doctor. I don't know if I can stay waiting anymore for this. That's really difficult.
I know, but you will go through that. But you should calm down, and the medication will help you. And the herpes disease is very serious disease, and there will be an consequences about it, and you will feel that way, but you should stay strong and continue your medication. And if you want anything, I'm here to help you.
Okay, doctor.
Do you have anything to ask about?
No, I don't think so.
So I think you the non-pharmacological approach may help you, that you should relax, meditate, and if you want me, I will refer you to psychological.
Okay.
It's over, right?
Yeah, your time is up. Okay. But let me tell you something. You are
Okay.
overstressed.
Yes, it's my first time with
كلنا اهل في بعضينا، في حد غريب، كلنا اهل في بعضينا.
انا عايزه اقول ان انا اصلا البتاعه رفع مني غصب عني.
والله العظيم.
والله هي جت كده بقى.
شوفي بس سبحان الله سبحان الله مكتوبه لك كتاباتك طالعه خلاص ما ينفعش ترجع. لا وعلى حظك اغير السيستم اللي هو ايه كان واحد بقى يراعيكي من زمايلك لا
يلا مش مشكلة عشان اتعود اعمل لوحدي واعرف ايه الغلطات
بصي
بتاعتي.
انت ممتازه والله وشطوره جدا. بس انت
بجد؟
قلقانه محتاجه شويه organization محتاجه تبقي relaxed. بصي I will give you my own experience as a past interlocutor before anything.
اوكي.
شفت كتير يوم ممكن كنت بمتحن فيه 50 60 70 ممكن 100 واحد رايت. اكتر ناس كانت بتبقى ممتازه وكويسه وابقى عارفه ان الناس دي ممكن لا قدر الله ما تعديش القلقانين المتوتر. تمام بريث. انا عشان كده قلت لك ديب بريث. انا في الامتحان ما اقدرش اعمل لك كده وانا الانترلوكتور بس الحمد لله بطلت يعني. لو انا الانترلوكتور ما اقدرش اعمل كده. اقصى حاجه هشاور لك تهدي ده لو انا عندي دم اصلا right like ما اقدرش اعمل اكتر من كده right. I wouldn't stop the recording. I wouldn't do anything and time keeps running and I will push by the way يعني I will keep pushing. مش معنى ان انت متوتره قدامي ان انا absolutely لا قلبي يحن وكلام ما فيش كلام من ده يحصل. تمام فخلينا كده واضحين and I have to relax. انت كنتي محتاجه تبقي relaxed اكتر organized أكتر. خلي بالك this woman had shingles okay and they were resolved. تفتكري أنا لو كان عندي shingles and they resolved and I still experience pain am I going to go to a doctor who doesn't know me? I'm going to see a doctor for the first time or I'm going to follow up with my doctor?
لا follow up with my doctor I guess.
Very well. Excellent. So if you are my doctor and I'm your patient, you should be more welcoming and to show that we know each other. Hello, Mrs. Nisma. Hello, Mrs. Smith. You can make a name fixed for you. You can use it all the time. Okay? استخدميه مع أي حد. مع interlocutor. Okay?
Okay.
Hello, Mrs. Smith. How are you? Hello, Mr. Smith. How are you? طبعا we have to think about the gender before we say Mr. or Mrs. Okay? How are you? How everything is going? When she says that she still has this pain and so on, oh, I'm really sorry for this. I know that kind of pain is really difficult. Show sympathy. Do not just give me information. Communication. طبعا أدرى الناس بالموضوع ده في الامتحانات بتاعتكم يعني بتطلع عينكم في موضوع الكوميونيكيشن مع البيشنت. The same thing. It's really important. يمكن انتوا في امتحاناتكم بتكون شويه focused على الفيزيكال communication اكتر وفي وداخل فيها body language وداخل فيها حاجات كتير. لكن هنا all your communication is recorded so your language is the only messenger.
Okay.
تمام؟ ف I'm so sorry. I'm really sorry. Would you tell me أنا قلت لك كل حاجة في الأول. Would you tell me a little bit more about this? How often do you experience it? Extend your time. ask a question. ومش بقول ان انت تقعدي تسالي نص ساعه مش بتكشفي بجد.
I think المفروض ان انا اسمع اكتر يعني من ان انا اتكلم.
لا ده بقى الحاجه الغلط.
مش
اسمعيني كل حاجه بس لو انت سمعتي اكتر وانا اللي بتكلم اكتر بقى انا عندي الابر هاند. بقيت انا اللي مسيطر في الكونفرسيشن. فهمتيني؟
فهمت.
لا انت تسمعي تمام حلو تديني فرصتي. ممنوع ان انت تقاطعي. انت لو هو يقاطعك بصي يقوم يضربك كمان ولا يفرق معاك وانت قاعده ساكته. حاضر اللي تشوفه يا باشا استناك بره. اوكي يقاطعك ويبوظ وكل شويه يسال اسئله ومش اوكي ما فيش بروبلم. لكن لما تبتدي انت تتكلمي بنقط اللي يكون عندك انت الكلام اكتر تمام وبتinvolve him in your conversation and everything. بس انت first of all انت المتحكمه في الconversation. Don't ever forget you're the doctor not him.
Okay.
تمام.
Okay.
طيب ending the conversation was good. Okay انا قفلت الوقت وخليته يقفل عشان اخليكي تعيشي الاكسبيرينس دي ان هو ممكن يعمل كده في الامتحان. بس خلينا واضحين ان في ناس كتير قلوبهم رحيمه وهيسيبك تكملي عادي. فاهماني؟ طيب احنا في real test المفروض according to OET المفروض احنا لنا 3 minutes preparation 6 minutes to talk 5 to 6 minutes to talk. recently أنا بتكلم recently يعني before طبعا اللوك داونز والdelayed test because of the COVID-19
Yeah.
بقالنا شهور بسبب الضغط في الأعداد والخصم والكلام ده كله interlocutors ممكن spend about 2 minutes only for preparation and about maybe let's say 5 minutes to talk, maybe less than 5 minutes, about 4.5 something like that. بس خلينا يعني very sure about this.
Yeah.
إن هي ده التايم بتاعي لما تيجي تتدربي مع الستادي بارتنر بتاعك لازم تتدربي على التايم ده.
Yeah.
اوكي؟
اوكي، انا عندي اسئله بقى. هو انا هل كل او التاسك بتاعتي مثلا فيها اسئله كتير او explain recommend mention، لازم لو انا مثلا وقعت مني حاجه او هل وخلاص الكونفرسيشن خلصت، هل هتحاسب عليها او ولا على مجمل الكلام اللي اتقال كله مثلا؟
طيب بصي نحسب الجدل في الموضوع ده. هل احنا المهم ان انا كلامي كله يبقى حلو ولا المهم ان انا اخلص التاسك؟ المقارنه هنا unfair. تمام؟ unfair ليه؟ انا ممكن يكون كلامي حلو بس ما غطيتش اي حاجه في التاسك. في ناس تتكلم كويس جدا ومعايا دكاتره في الكورسز كده كلام حلو قوي قوي بس ما غطيتش حاجه من التاسك. تمام؟ ممكن حاجه او حاجتين ماكسيمم. اوكي؟ وفي واحد بيتكلم نص نص بس بيغطي التاسك كله. فطبعا هنا وخلينا واضحين في جزء سبجكتيف في التقييم. النقطه بقى عشان نصحح المعلومه، انا ممكن اكون غطيت كل حاجه في التاسك وبتكلم كويس بس في الحته الاخرانيه وقعت مني او حاجه في النص جلت انا ما سمعتها ما خدتش بالي منها او حته انا ما عرفتش ادخلها فعملت لها باس يعني عملت مانوفر حواليها كده عشان اعدي منها واخرج منها بسرعه. هل هنا انا احاسب؟ اوكي؟ لا طبعا.
اوكي.
لو الاوفر اول كويس غطيه كل حاجه وهي نقطه واحده غصب عنك الوقت ما اسعفكيش استحاله هوقع لك كارد عشان نقطه واحده. لكن عندك اخطاء جرامر ودي بقى كده اخطاء جرامر، في هيزيتيشن، في بوزنج، في اجزاء ما اتغطتش، في كوميونيكيشن ما وضحش، في اي حاجه من الكرايتيريا اللي انا حاططها قدامي وانا بصحح مش موجوده اكيد هيوقع التاسك. فهمتيني؟
طيب انا عايز سؤال تاني معلش. هو لما اجي انهي الكونفرسيشن مع بيشنت اعرفه، هل هتختلف في نهايه الكونفرسيشن مع حد معروف مع بيشنت ما اعرفوش؟ يعني البدايه
عادي.
اختلفت، هل النهايه بتختلف برضو؟
لا في كلا الحالتين I wish them farewell.
Yeah, okay.
I wish them a farewell. يعني I wish that I see you again in a better condition. I'd like to see you in a couple of weeks in order to check on your condition مثلا يعني.
Yeah, okay.
That's it يعني مش اكتر من
يعني
كده.
هل طب الجرامر بتاعي وانا بتكلم هل كويس؟ الطريقه
جدا
كويسه؟
انت كويسه جدا على فكره. انت يعني نص الموضوع عندك قلق واتخضيتي بقى فانت
انا
فهمتيني الموضوع.
اتخضيت.
انت اتخضيتي اتخضيتي
انا
هتكمل.
ما اعرفش، انا فجاه لقيت ايدي حد بيقول اسمي، اللي هو ايه ده وانا عملت ايه؟ ما اعرفش.
اتاريكي يا عيني اتاخرتي على ما رديتي.
على ما رديت جالي حاجه صدمه بس. اوكي، ثانك يو.
لا بس well done والله. انت كويسه. انت محتاجه لما تيجي تتدربي بس تتدربي مع حد تركزي معاه على التايمينج، على البراكتس، على ان انت ما تخافيش ما تبقيش قلقانه والكام نقطه اللي احنا اتكلمنا فيهم. تمام؟
Okay, thank you so much.
Okay, so let's take another card. Okay. All right, so let's see the people here. Okay, I need a male. Like Dr. Imran. Dr. Imran. Dr. Imran. طيب دكتور عبد الله.
Yes,
Okay. Hello, how are you?
fine, thank you.
Okay. And you see the card?
Yeah,
Okay, you have 2 minutes exactly to prepare yourself, and then we're going to run the card together.
okay.
Sorry, Miss Nisma, is this a last card or?
There's one card after that.
Okay.
Okay,
Okay.
shall we start?
Okay. How are you? I am Dr. Abdullah. Can you tell me what have you been suffering?
Well, I've been having some stomach cramps, and they're usually happening whenever I drink milk or have any kind of dairy product.
I'm really sorry for that. Can I ask you more about that? When did that start?
It's been for a couple of weeks now.
And is there any associated symptom with that, or it is just what you say?
Well, no, just the pain in my stomach, and I've also had some diarrhea from time to time.
Yeah, can you localize that pain, please?
It's around the upper part of my abdomen.
Yeah, and does that pain go to any other side?
No, no.
Okay, let me explain to you what is the cause of that symptom you are suffering from. It is because of inflammation in the wall of your gut. It is called lactose intolerance. It is due to drinking milk. It makes some inflammation due to some problem in the wall in your gut. Are you following me?
Okay.
So we have to make some investigation and labs and imaging study to put our hand on the exact cause. Are you following me?
Okay, doctor, but it sounds like a lot of things. Is there some things that I should be worried about?
Uh, what do you worry about?
I don't know. I feel that this could be something more serious than it is.
What make you feel like that?
I don't know. I read a lot about people having problems like this, and they end up with a cancerous situation.
I appreciate your concern, but I would like to assure you it is not a must to be a serious cause, as there are many causes, but we have to wait until we do labs and imaging study to put our hand on the exact cause. And now I'd like to assure you and you have to know that your health is our priority, and we will do our best to solve the problem you have. And it take times to until the problem in the wall in your gut to heal, and I will prescribe you some medication to help healing of that problem in your wall of your gut. Are you following me?
Well, yes, but how long would that take?
Actually, it may take some days, 2 weeks, until it heals, and it will be with the aid of some medication I will prescribe you.
Okay.
Okay. Do you have any question, any concern?
Well, doctor, I just need to be normal again. How long would that take?
Of course, you have to know that your health is our priority, and it will take, as I told you, from some days to a week until healing occur, and it will occur with the aid of some medication. And we will follow you and make some checks up at my clinic until everything is going well.
Well, I'm not sure about this, doctor, but I still feel a little bit skeptical about this point. I need to, you know, like, to know whether this is going to be my condition forever. I wouldn't be able to deal with dairy products. They're part of my routine and part of my diet. So I need to know just at least headlights.
You have to don't drink milk that contain fructose, as that type of substance make that type of disease and make that inflammation in your in the wall of your gut. Are you following me?
Yes, yes, I'm following.
Yeah, and I'd like to assure you, and everything is going well, and your health is our priority. And I will do my best to help you and to solve the inflammation in your gut.
Okay. Okay.
Any question?
No, I don't think so.
Okay, thank you.
Okay, thank you. Well, actually, I give you a few more seconds because I was the one who is relucting a lot. I was asking a few questions, and as you can see at the very big end of the card, I started to re-ask questions to deal with the whole thing again, okay?
Yeah.
Communication again. Well, I understand that you're worried, and I understand that this is really upsetting situation, and anyone in your condition would feel the same. But again, you cannot determine anything in the meantime. We have to stick to the plan. We have to do our tests, whatever, and so on. Okay? Deal with the concerns. Respond to the concern, not only by answering them, but by reassuring the patient. على فكرة مش لازم الكارد يقول لي reassure. لازم الكارد يقول لي reassure. My job is to advise and reassure, explain everything. My job is not to convince. And my job on the test day, it's not to convince the patient. لو مش مقتنع يروح يخبط دماغه في أي حيطة. يعني شوف في كام حيطة في القاعة يقوم يخبط دماغه ويرجع لي تاني. مفيش أي مشكلة خالص. أنا وظيفتي إن أنا أوضح، أطمن، أوكي، أشرح الموضوع بكافة الطرق عشان أوصل لك المعلومة. أنت لسه مش مقتنع. My job is to answer your concerns and that's it.
تمام.
Okay? Well done. Excellent. Great job.
Okay, thank you.
Thank you. All right. The last card, last but not least, I know, Dr. Yasser, you've been asking for this. Okay, so It
No
would be
problem.
yours. I know, Allah, you've been eager to this. I just wanted to have two different people. Okay. All right. So can you see the card?
Yes, I will try this.
Yes. Okay.
Hold
You have 2 minutes starting from now.
on. Okay.
Okay. I'm ready. Let's go.
Good evening. I am Dr. Yasser. I want of treating a doctor. How are you so far?
I'm okay.
What's the problem today?
I need some time off work.
Yes, why?
I don't feel good, doctor. I feel so down, and I need to step away from everything.
Yes, yes. But I am think your health is good. No problem for you.
Well, doctor, the problem is that I've been through a very difficult divorce, and I wanted to take like a couple of weeks away from work. Okay, and my boss told me it's okay, but I need to talk to you first.
Yes, this is social problems you can deal with social worker, but for us, your health is good. No problem for you.
Well, how do you know? How do you know that I have no problem? You didn't even evaluate me or assess my condition.
Because you are not complaining something. Only you need the vacation without any complaint.
And that because I'm not going to take some time off to stay home and play. I just want to stay home for some time because I just need to relax. I need to stay away from everything.
This is you are take from social worker, not from medical side. If you are have a medical problem, we can management and give you the certificate for work leave.
No, no, I don't want this, doctor. I need that work leave certificate, and I need this for a couple of weeks. That's my right to relax and to stay home for some time. That is not
This,
acceptable. Telling me that that there is nothing wrong with me and I shouldn't take the time off.
this is sick leave is a serious matter. We can't give it to anyone except if it is actual disease. This social problem or social problem must be resolved with the social worker. But I wanted to advise you to go to the psychiatrist to evaluate you.
Okay, so why should I go there?
For, to assess your condition if it is need any something for you by through psychiatrist, but for your condition is good, not show any medical disease, any problem. Can we give sick leave for it? We can't give sick leave for it for without any problems.
Well, I don't know. So you think that the psychiatrist will give me the time of work?
He can give you, if according to the evaluation of you, this is his work. He can evaluate for you and see the how to manage your stress. Can you management your stress without vacation? Can you management with medication? According to he will see. You
Okay,
understand me?
okay.
It is clear.
Yes, yes, it's clear. I guess so.
Thus, you are at the end of the visit. I want to explain why I am told I am refused for giving sick leave. It is not our matter because we are clinical. This is the matter will evaluate by social worker or by psychiatrist, who is the one will see you and see advise you about the best for you. You understand me?
Okay,
Okay, thank you.
thank you. Okay. طيب. كان
هي
في
جت
sharp tone.
the main
كان
problem for all most of medical doctors, especially in Saudi Arabia and our country, sick leave. Only they
I
come
know.
for sick leave.
And you know how much I love it.
Even
How much I love this
even
card.
even if no one patient, no one husband for he told ask me I will come for you. Why? You are no, I am will come for sick leave. Thus I am not take OBD for this matter. I am not
The-
taking my work OBD at all. I am working DR for away from sick leave.
Well, I understand that sick leave is always a problem for any doctor to face in the OET test because usually the patient asking for it is very reluctant and asking for lots of things. Well, let me tell you something. When I was talking at the very beginning, you had sharp tone. Again, sharp tone is not about being loud or rude. It's about being direct without any sympathy with the situation. You should have shown a lot of sympathy while you're talking to the patient because she is not feeling okay and she's down, and I try to show this even in my tone and how I spoke. So the sharp tone was in also repeating many times to the patient that you wouldn't and you shouldn't give her this, and this is not physical, and it's as if you're saying this is not my job, you know. But asking her about what's going on, maybe asking her about how does she feel, and telling her that this is normal and you have a suggestion by seeing a psychiatrist is a better way to tell her the same thing. And at the end, you would not agree to give her the certificate, whatever happens. All right? Well done, although I know it's been a while for you since you've been practicing, but you did a good job. So I'm going to look at the questions.
But sorry, Ms. Nasma. One question about this card is we are not knowing something we can speak to the patient. Thus, we are our language not appear in front of the meeting.
I'm sorry again. The last part again. The sound was a little bit distant.
What?
الصوت بس في آخر جزء كان بعيد.
I'm speak about this card. We can't speak in only refuse to give her. This is the only speaking our language not appear. We are can't only explanation few words we are used, not use grammar, not use how to can evaluate us about this card.
Well, actually, you had few mistakes regarding the grammar, of course. As we were just talking about this yesterday, we still have problems in how to form the sentence and the question. But overall, you covered the main problem. But I think altogether, the grammar with the sharp tone, they played a bad effect on your card.
Yes.
Okay? Okay. Let me just look here at the questions. The speed of speaking and no hesitation. Okay, should I emphasize everything again in the end of the discussion? Well, it's not a must. It's not a must to do this. Recapping or summarizing what was discussed is not something fixed that you have to do. Okay, at the end, however, it's preferable if you still have time to do that. I think if there is time, yes, exactly. Fluency is important, of course. And by fluency, we mean that we speak without being stopped or without hesitation and without lots of pauses. Okay, what do you mean by fluency? I think I covered this. Your speed of speaking, no hesitation, no pauses. Okay, that's the answer as well. Yeah, I get that very well. Excellent. All right. طيب I hope طبعا ان تكون السيشن دي كانت بالنسبة لكم مفيدة. I'm so happy to have you all here around, and it was really good to have you. إن شاء الله بإذن الله we will have another meeting. برضو هنحاول كده إن شاء الله لحد ما يفتحوا لنا الامتحانات تاني to have another meeting. I know the last one was like a month ago or something, بس Ramadan Kareem. Okay, and you know time is a little bit challenging. Homeschooling is terrible as well. Okay.
هو فتح الامتحانات اللي هو اللي على الموقع كده يعني
لا هو الحجز شغال. لا هو الحجز شغال عادي، بس فكرة ان الناس بقى تخش الامتحان طبعا واقف يعني النهارده 2/5 برضه اتلغى يعني. اوكي 16/5 I believe will be cancelled.
لا ما
as well.
هو في الحجز في المنزلين في الجدول ان ما فيش امتحانات في 5 و6 يعني هو كده اكشوالي هم كانسلوا 5 و6 كامل.
بالظبط عشان في ناس لسه ما جالهاش الايميلز، بس في ناس لسه ما جالهاش الايميل. تمام ففي ناس لسه عندها امل، بس هو يعني it will not be functioning. وحتى لو هيعملوا functioning مش هيعملوا في بلد وبلد لا، لان هم حتى ما عندهمش لسه الآلية هتمشي ازاي، يعني مش عارفين هتمشي ازاي.
يعني ممكن الحجوزات بتاعتنا دي تتأجل اصلا، الحجوزات بتاع شهر 6 و7 او 8. 7 و8.
اعتقد ان في البدايه من 7 الدنيا هتبقى واضحه اكتر، لان حتى الدول اللي مددت الامرجنسي سيتويشن مددت لحد 7، يعني في ناس لحد اول 7 لحد نص 7، فاحنا يعني حتى الان الموقف مش واضح بقى، ما نقدرش نجزم بحاجه، بس I believe ان هو هيكون ان شاء الله يعني بدايه من 7 كده الدنيا ترجع تران تاني الامتحانات.
هم ممكن يبعدوا الكنسله لحد قبلها بقد ايه؟ يعني ممكن يكنسلوا او يأجلوا قبلها
لحد
بقد
قبلها
ايه؟
بيوم بيومين ب3.
يعني
هو سكيدولد وبيبعت كده يعني.
بيبعت
في ناس بتاع 2/5 ده كان مبعوت لهم من فتره، وفي ناس 16/5 كان مبعوت لهم قبليه، وفي ناس لحد دلوقتي 16/5 ما اتبعت لهمش حاجه يعني. تمام. اوكي، ان شاء الله باذن الله كده يكون عندنا لقاء قريب. ثواني في بقى اسئله تانية. اوكي I arrange okay, could you tell us the band of last speaker about C to C+? I arranged blood tests, thyroid tests, and ECG. Do I need article before ECG? Well, you can say an ECG or you can say ECG. طيب ايه الفرق بينهم؟ والله you can run more than one ECG, so they can be ECGs. Okay. And the word ECG is also a known thing, so you can just leave it without an article. So both are correct. أسأل بالعربي يعني لازم articles. Okay. تمام. Just to make sure I got this right, in the last scenario with the sick leave thing, do I have to use sharp tone? No, you shouldn't. You should be more sympathetic, okay? Because the patient at any time, whether he's lying or pretending or even telling the truth, he should or she should be treated nicely. The record will be on YouTube, yes. About C+. About C+. Okay. So, any other questions before we go? Before we call the night?
Have a nice day, teacher.
Thank you.
God
I
bless
miss
you.
it.
Also me, teacher.
محدش بيقول لي have a nice day دلوقتي.
excuse me Miss Nasma.
Thank you.
اتفضلي.
كنت عايزه اسال حضرتك بالنسبه للكاردز اللي بيكون يعني بيقول فيها you have examined the patient، هل هو ده برضو عادي ابدا الكارد can I help يعني how can I help you كده ولا ايه؟
You have examined the patient أو you already مش عارفة did ايه أو something like that. طيب تاني البارت اللي فوق ده في السبيكينج اللي هو الباراجراف الصغير ده بيبقى سمري للموضوع كله. خلي بالك انت لو قريتيه هتلاقي نفسك فهمتي الموضوع اصلا. تمام. اللي تحت ده التاسكس اللي بتمشيكي بتبقى جايد ليكي بوينت باي بوينت انت هتروحي فين وتيجي منين. فمش شرط عشان اقول you have examined the patient ان انا خلاص كده ما اتكلمش في حاجه. depends على اللي جاي بعد كده. تمام. احيانا بتلاقي اللي جاي بعد كده ان هو بيبتدي يسال في take brief history. طب انا يبقى ازاي بقى I examined the patient و I didn't take the history. فاهماني؟ فخلي بالك من الحته دي. stay alert للتاسك اللي جايه بعد كده.
يعني امشي مع التاسك احسن، يعني السمري اللي فوق ده بس بيديني سمري عن الكونديشن نفسها وكده
بالظبط.
وبعدين امشي مع التاسك
سيتنج للموضوع كده، دخلت الموضوع كله عشان تشوفي المشهد من بره فتفهمي الدنيا ماشيه ازاي مش اكتر.
تمام. شكرا ثانك يو.
اوكي. امتحان 13/6 هيكون قائم ولا هيتلغي؟ هو فعلا يعني غالبا ان هو هيتلغى. اوكي. لان هم عاملين بوستبون لان هم نفسهم working from home the OET team كله. ف I don't think ان هم لان الحاجه بتاعتكم تتصحح manually بالنسبه للرايتنج. I don't think they will take them home. That will be against the rules يعني. عشان كده حتى Cambridge لغت كل امتحانات الاي جي. فحتى الآن I don't believe it will function. Do I have to follow the sequence of the points they give me? You have to be logical. يعني ممكن السيكونس بتاع البوينتس ما يبقاش يبقى فيه خطوة أو اتنين illogical، مش ماشيه بالترتيب المنطقي، فانت رتبها حسب ما انت شايف. لكن انا ما انصحش انك تتنطط في الكارد، يعني تفضل طالع نازل او كده. حاول تكون منطقي وما تسبقش الاحداث عشان ما تلخبطش الانترلوكتور. Okay. Is there any other question before I go? Thanks a lot. Thank you.
مش نسمع نبص للانترلوكتور واحنا بنكلمه ولا نبص في الورقة بتاعتنا؟
ان شاء الله تقعدي حتى تحت الترابيزه ولا يفرق معايا.
مش مهم ان احنا نبقى
body
فعلا
language
مبتسمين.
لا خالص. البادي اهم حاجه تكون صوتك واضح عشان الريكورد وذاتس ات. لكن فكره ان انا ابص له دي مش قضيتنا خالص يعني.
يعني لو عايزين
كانت
نركز
بتبص
مع الورقة
للسقف
مفيش
وتشتغل
مشكلة.
معايا. ايوه بقول لك في ناس كانت بتبص للسقف يعني وانا قاعده عادي ولا كان في حاجه. السقف عاجبهم.
الانترلوكتور not the examiner. Not
نعم.
the examiner.
The
Not the
interlocutor
examiner is not the examiner.
لا انا مش سامعه not the
مش
examiner.
هو الممتحن. Yes.
قصدك الاسسور يعني الاسسور. You mean the assessor. The
Yes.
assessor is back there in Australia and it's recorded. It's not like it's UKVI مش بيبقى متسجل فيديو or something like that. ما فيش اي مشكله خالص في البارت ده، ما تشغلوش بالكم بيه يعني. body language مش داخل اصلا معاكم في التقييم يعني. Okay, so I'll see you إن شاء الله again. Okay, thank you all. برضو انتظروا كده هينزل ميعاد السيشن اللي هنعملها تاني. Okay, keep following up. وإن شاء الله السيشن دي تنزل وبرضو ال corrected letters will be there. Thank you. Have a lovely night, everyone. Thank you.
If you will do session told to us before, excuse me, one day or like that, because sometimes maybe we are not see the WhatsApp or like that. If before one
I'm
day.
sorry, Dr. Yasser, something went wrong with the sound. Would you please repeat the last part again?
Okay, I will speak by Arabic. لو ممكن ترسلي قبلها بيوم ولا حاجة.
هو موجود على الجروب من بدري والله. موجود على الجروب من بدري.
النهارده ولا أمس؟
لا على جروب الفيسبوك. انا كنت قايله لكم تابعوا على جروب الفيسبوك عشان انا بيبقى صعب ان انا اخش على كل الجروبات ابعت على واتساب وكده. بس تشيك خليكم متابعين جروب الفيسبوك، انا بنزل عليه من بدري. اوكي.
الفيديو المحاضرة على جروب الفيس ولا المحاضرة تسجيل المحاضرة
على جروب الفيسبوك. على جروب الفيسبوك.
اوكي.
Okay. Have a lovely evening everyone. Bye bye.